Hi, Joel.
Hi
I'm
there.
Kim, your pharmacist today,
Mm-hmm.
and I see you have a prescription here for us.
Yes, I do.
Can I counsel you on how to take it?
That'd be great.
All right. Well, today I have some Advair for
Okay.
you. It is a combination of salmeterol and fluticasone.
Okay.
And what does your doctor tell you this is for?
He said it was for my asthma, more long-term than short-term.
Right. So if you have an asthma attack, you won't want to take it. It won't be effective while you're having an attack. It's more of a long-term preventative measure.
Okay.
Does your doctor tell you how to take it?
He said I'd be taking it twice a day, but that's all he said.
Right. So every 12 hours, most people take it once in the morning and once at night.
Okay.
And it's a little bit of a different kind of inhaler than you're used to having. It's in a powdered form.
Okay.
So I'll just show you how to use it. You open it up.
Okay.
You'll put this part up to your mouth.
Okay.
And then you'll flick the lever, which will release the powder. But you'll actually have to inhale to get it into your lungs.
Oh, okay.
So you'll inhale really quickly rather than slowly with your other kinds of inhalers. And then you can just breathe normally.
Okay.
But definitely make sure you rinse out your mouth afterwards to get all the powder residue out of your mouth.
Okay.
It really works in your lungs, and you don't want it to stick up in your mouth.
Okay.
So can you just show me how I told you to use that?
Yeah, you said I'll slide this little piece here back, and then stick the mouthpiece actually up into my mouth, and then flick the lever to release the powder, and then breathe in real quick so that it'll pull the powder out of it and down into my lungs, and then I should breathe normally for a bit, and then wash my mouth out so that I can get the powder out of there.
Right, that's absolutely correct.
Okay.
And you'll see here it tells you how many doses you have left.
Okay.
So when it gets down to about 14,
Okay.
you'll have a week left.
Sure.
And so you can come in and we'll get you a new inhaler.
Okay.
Because you're going to be on this for quite a while. Because it's preventative. You'll be on it regularly. Did your doctor tell you what to expect with this medication?
He said it might give me a headache and I might feel like I had a cold for a bit. But that was all.
Right. Some people have experienced a headache or a cold-like symptoms.
Sure.
Not a lot of people, but a good amount of the population. And they're pretty common side effects. They're not that serious. But if they become too much for you, definitely give us a call and we'll see what else we can do with your therapy.
Okay.
And a lot of times the symptoms will go away after a while, so it's not something to worry about too much. But if you do have cardiovascular problems, if there's something different with your heart, hardly anyone has had it, but it is a very serious side effect of this medication.
Okay.
So it's something you want to watch out for, and definitely give us a call if you notice anything abnormal.
Okay, I will.
Also, you'll see a black box warning on this medication.
Okay.
And it actually causes salmeterol, one of the medications in here. When given alone, it causes sudden death in asthma patients, which I know sounds really scary.
Yeah.
But it's actually not at all because with the fluticasone, it's completely safe to give.
Okay.
So that's why they actually combine the two medications in Advair. It's so that it totally reduces the risk of that. And it's very safe to take these together.
Okay.
And if you miss a dose, you can take it within, go ahead and take your next dose as soon as possible, as long as it's not within 3 hours of your next dose.
Okay.
So if it is within 3 hours, just skip the missed dose and go on taking it as your normal schedule every 12 hours.
Sure.
All right. Well, you'll want to store this in a cool, dry place.
Okay.
So in your kitchen is a really good area, as long as it's not over the stove where it's hot and there's moisture.
Okay.
A lot of people store it in their bathroom, which isn't a good place at all because of all the moisture, especially with a drug in a powder form.
Yeah, that makes sense.
So your bedroom's a good place as well.
Okay.
All right. Well, just to review, what should you do if you miss a dose?
I should take it as soon as possible, unless it's within 3 hours of the next scheduled dose, and then I should just wait until that period of time is up and take it the next scheduled time.
Right. Yep, that's absolutely right. And where are you going to keep this in your house?
In a cool, dry place, not anywhere hot like above the stove or somewhere really moist like the bathroom. So somewhere dry like a bedroom.
Yeah, that's a really good place to put it.
Okay.
Do you have any questions for me today?
I think you've told me everything I need to know.
Okay, well, let me know if anything comes up and go ahead and call us. Have a good day.
Thank you so much.
It goes with how to take it versus...
Made sense.
Oh, poop, I'm recording.